A Holistic and Imaginative Approach by Rachelle Nash, an Indiana State University nursing student for Nursing 444. And I will be discussing the population at risk, or PAR, of adults with low income and no insurance. The learning objectives for this presentation include understanding the holistic viewpoint, recognizing why those of low income and no insurance are an at-risk population, developing an understanding of the current best evidence-based guidelines for patient care, and describing at least 2 ways to help change a community. At this time, I will pause for a brief moment so you can take the attached pretest. An outline of this presentation includes what is the population at risk being addressed. The purpose of the slideshow is to use imaginative and creative strategies to develop a game plan for holistic assessments, which in turn can positively change a community. What is included in a holistic approach? The difference between people with and without health care, who has access to mental health care, resources for the PAR in the community, why depression screening is important and the process of referring patients is needed, and lastly, why using evidence-based practice is important. This slide is an educational slide in regards to beginning information and some options available. A holistic assessment includes a spiritual, emotional, and mental standpoint, in addition to any physical dilemmas one may have. For those of us with insurance, we tend to receive reminder calls or letters in the mail reminding us that we are due for a flu shot or an annual physical. We are also able to call our insurance and obtain an in-network provider for a specific problem we may have, such as needing to speak with a counselor. People with low income and no insurance may feel that the same options for the insured are not available to them, but that is not the case. I work for a federally qualified healthcare center, and we offer a sliding scale option for patients based on their income. Some pay $20 for the whole visit, which could include an EKG, an in-house A1C, and so on. These patients are also able to schedule visits with a behavioral health provider for a $20 copay. You can find the sliding fee scale at this link that I have attached for Windrose Health Network. So you may ask, how do we find these patients who are uninsured and have lower income? We must reach out to the public and individual people, letting them know of the resources that are available in their communities. Utilizing social media such as Facebook or Instagram or Twitter, sending flyers in the mail, and having a sign outside one's practice stating that they see patients without insurance are all great ways to reach out to a local community. WindroseHealth.net is the federally qualified healthcare center that I work for. We have offices ranging from Indianapolis to Hope, all the way to Trafalgar, Indiana. I have been living in the same community for over 15 years. When I applied for my job here at this federally qualified healthcare center, only 7 miles away from my home at the time, I had no idea it even existed. Still, this many years later, there are so many in this community who are unaware of what we can offer. I share the informative posts of my company on Facebook, utilize word of mouth, and I pay attention to opportunities to assist people I know in making informed decisions about obtaining health care. I run my church's prayer chain as well, And if I hear a need that our office can help with, I reach out and let those people know of the resources available. Once we reach these people, then the nurse can develop a holistic assessment. In Indiana, people can call 211 straight from their phone. And that's a resource that helps them in finding healthcare options. It also includes food and homing options. I have included the link for 211 as well, if that's easier. I hope you enjoy. A system that works. For all new patients at my place of employment, they meet a patient navigator. This patient navigator assists the patient in obtaining insurance, if applicable, while informing them of resources available in their communities. That could include having a transportation to the doctor's office, using a Medicab service, food pantries, things of that nature. After the patient meets the patient navigator, we continue the process. My part as the nurse is to screen the patient for depression. These are a few aspects of a holistic assessment for the adult, underinsured, low-income population. If the patient is positive for some level of depression, then they are referred to a behavioral health provider. Depending on the situation, that patient may be further referred to a psychiatrist who can prescribe medication. The Healthcare Forum provides a wide range of opportunities to reach our patients from a holistic approach. Not only can we offer mental health, but a wide range of information from the elderly trying to figure out what Medicare supplement plan they need to purchase for that year, to new pregnant patients who may need proof of pregnancy and obtaining Medicaid. This advancement of benefit delivery aids in the process of providing the best practices for this PAR. A teamwork approach in the healthcare system is one of the best ways that we can reach so many people and utilize all the resources available to them. I hope you have enjoyed this and you can take the post test now.